Hello and welcome from wherever you're tuning in. My name is Allison Stroud, MR Business Marketing Manager at Philips. I'm very excited to present to you today our webinar titled Improving Throughput and Maximizing Patient Experience at Poole Hospital with Ingenia Ambition. Poole Hospital is an acute general hospital in Poole, Dorset, England. Built in 1907, it's expanded from a basic 14-bed facility into a 789-bed hospital. It is the trauma center for East Dorset and provides specialist services such as cancer treatment for the entire country. Today, our friends from Poole Hospital will share how they are maximizing the overall MR patient experience and throughput on their system with helium-free MR operations. But before we kick it off, let's first go over the agenda and some housekeeping rules. So of course, you've already heard the welcome from me and a brief introduction of our speakers. Next, you're going to see a presentation and then followed by a Q&A at the end. So make sure to stay tuned where you can have your questions answered live. And then finally, we ask you to hang tight and answer a few questions in a survey so that we can better understand what you like and what to see for the future. There's a few consoles that you'll actually see in your screen panel. The main one that I want you to pay attention to is the Ask a Question to the presenters. So you can ask a question at any time via the chat. The presenters can choose to respond to you by chat, or they can also answer your question live. So thank you so much for joining us. Make sure that if you have any questions, please let us know. And like I said, hang tight for the Q&A at the very end. So now I'm proud to present to you Dr. Ravi Ayer, Consultant Radiologist and Clinical Director, and Aleksandra Kudyk, Deputy Superintendent of MR, as they share about their firsthand experiences on the system. Now let's tune in.
All for listening to us. It's a new experience for us, doing these virtual webinars. We would love to have been there at ECR, but this is a new world, so we're getting used to, I'm sure as all of you are getting used to these remote webinar tutorials and Zoom conferencing, etc. We've been asked to talk to you about, the title is here, Improving the Throughput, Maximizing Patient Experience at Poole Hospital. Just our initial experiences with the Ambition X MRI system at Poole. So just a little bit of background about Poole Hospital. Poole Hospital is an acute general hospital on the south coast of England, lots of beaches and sunny weather. It was built in the early 1900s. It has almost 800 beds. Its service portfolio is currently weighted towards the acute specialties, namely trauma, maternity, oncology, pediatrics. In the coming decade, we have a sister hospital 7 miles down the road, and there will be a period of major health reconfiguration taking place in the local area, where Poole Hospital will become the site for planned care, that is namely oncology, musculoskeletal, etc., whereas Bournemouth Hospital 7 miles down the road will be the trauma and acute site. So major health reconfiguration coming. You can see the setting of our hospital on the lakes and near the beach. This is the sort of content that we're going to be running through in today's talk. When we were looking for a replacement for our MRI scanner, we really had three basic criteria. We hinged on three basic criteria. One, we wanted the patients to go through the scanner quickly. We needed the productivity and the throughput of the scanner to be, optimal and high. When the patients were in the scanner, we wanted them to be comfortable, have a good experience, and we didn't want them to be distressed. And also we wanted excellent images to enhance patient care, provide excellent diagnoses, clear diagnoses for our clinical colleagues. So those were the three guiding principles, if you like, when we were selecting an MRI scanner. So in this talk, we will just talk a bit about the Philips Ingenia ambition that we finally went for. And these are the sorts of things we're going to be talking about. The first thing we'll talk about will be the smart workflow set up on the scanner. Then we'll touch on what it's like to be a patient within the scanner and an operator supervising that patient, the inboard experience or the ambient experience. Then we'll talk about some of the features on the scanner, namely the vital eye, compressed sense, which you heard Simon talking about there. We will talk about how we use it and the benefit to us. Then we'll move on to some of the movement reduction software that comes with the scanner, the Multivane XT. And then we'll talk about the features that allow us to optimize scanning on patients who have implants. And then lastly, we'll touch on, what is probably the headline feature of the scanner and the helium-free operations. Again, just give you a little bit of history. Poole Hospital has always had a history of innovation. We're always early adopters of technology at Poole Hospital. We had the first Ingenia Ambition X installed in the UK, so we're pretty proud of that. But now we've got 3 CT scanners, 3 MRI scanners, and 1 PET CT scanner. So we're a well-stocked department in terms of imaging equipment. Let's just run you through, for interest, some of the installation processes at Poole Hospital. You can see this is the sort of gutted room, the MRI scanner that the old MRI scanner was removed, and there's all building equipment scattered around the place. You can see that the roof of the MRI scanner is coming off because we had to. You can see the truck from Holland arriving. We had to make sure that the climate conditions, the weather conditions were absolutely optimal, that the wind was reduced and the road had to be closed, and all those features had to align perfectly for us to be able to complete this install. So in the middle of the night, it was a windy night, but the wind dropped down for an hour or so mercifully and allowed us to crane in the scanner through the roof of the MRI department with very narrow tolerance on either side. A little bit of a nervous time, but we got the scanner down through the roof and into the building. You can see it here with all the housing removed. And now here is the final finished product. And you can see with the sort of soft color changeable lighting that we've got on the scanner. I'll now pass you over to Alex, my colleague, who will take you through the smart workflow.
Okay. Thank you, Ravi. As you all can see on the previous slide, our room is very welcoming. The first thing to notice when entering the room are the lights, which are very calming and mellow. And some patients have even mentioned that it looks like going into a spa. Moving forward, we have screens on each side of the bore, which is a new type of feature, new generation of the scanners. They are particularly useful these days of pandemic, when one radiographer can input the details of the patient in the control room, whilst one other radiographer or assistant can position the patient on the scanning table and check the patient's identity that is accessible very easily on the screen. So there's no paperwork needed to be taken into the scan room. We also can control the intensity of lights or update patient's weight, change the patient position if the patient is very anxious and will change his mind that he wants to go feet first. Occasionally, when we need to scan cardiac patient of this machine, we have a guide to place ECG leads. When the patient is positioned, the radiographer can push the start button on the screen, and screen commences as soon as the door is shut on exiting the room. On this slide, I just want to tell you about the inboard experience, which plays a huge role in the comfort our patient, particularly claustrophobic and pediatrics. When the screen at the back wall with the screen at the back wall, we are able to play any DVDs and moving pictures chosen from the panel. These pictures are known as journeys, and they can be easily changed to suit the patient. When using those journeys, lights change the color with the changing pictures, and soothing music plays through the patient headphones. When scanning head-first position, a mirror is placed over the patient head, and this allows the patient to see the image played and also greatly reduces the feeling of being in a tunnel. And the scanner is also automatically informs the patient of the length of the next sequence and before any table movement. So this is also really, really important. So far, patients' feedback has been really positive. We have comments such as, I can manage my claustrophobia much better on this scanner. The scan went much quicker than I thought it would, so which is very important to us. Now, many patients do not need to take sedatives in order to be scanned, and other patients who normally would have needed a general anesthetic do not have, can tolerate the scan without. On this slide, I just want to show you what does it look like at the back screen as the part of the inboard experience. The screen shows a bar with a number of length of each sequence. And as the examination continues, the bar moves, so patient knows how examination is progressing. The bottom picture is for breath hold sequences, and a circle appears showing the length of the breath hold. Patient can now see how much longer they will need to hold their breath. And this has also improved the quality of images by reducing movement artifact. A significant proportion of our patients are pediatrics, and this is a picture from a preparation session with a play therapist. And inboard experience has impacted them very positively. We can invite children with their parents or guardian to view the scanner prior to their appointment with a play therapist or radiographer. This allows them to see the room, experience the equipment, and understand what will happen during their scan. This preparation normally takes around 10 minutes, and this greatly reduces the patient anxiety, child, or the parents. And as a parent, I can say it greatly reduces parents' anxiety. The mirror allowing children to view the DVD, and also a child can see their parents throughout the scan, further even more reducing children's anxiety. We have been able to produce diagnostic images of children younger as 3 years old with the help of this preparation and motion-controlled sequences. But later on, Ravi will show you some examples. We also have excellent results with autistic children using the preparation and DVD. On this slide, I would like to show you an example of an 8-year-old boy who came for his head scan straight from the clinic. No preparation has been done. The boy selected his favorite cartoon, which was played during his scan. The scan took around 15 minutes. After that, he was very unhappy and complained that we didn't let him to finish the movie. So this is one of many examples of our success scanning children. Now let me hand you back to Ravi. He can explain a little bit of statistic and numbers.
So as Alex was saying on the previous slides, we we have quite a large pediatric or child health portfolio at Poole Hospital, and part of that is obviously scanning those children. And we perform, locally, we are the site that performs general anaesthetic scans on children. So this here is a graph of our general anaesthetic activity at Poole Hospital. We've included data from 2018. And the first dotted line is the general anaesthetic activity prior to the Ingenia Ambition install. So this was done on two scanners, is that correct? Two scanners. Yeah. Oh, okay. This was our total general anaesthetic activity over the year. We can then see that when the Ingenia Ambition was installed, we can see a reduction in that general anaesthetic activity. And then we can see a further reduction in April of this year when the COVID pandemic struck and we essentially suspended all but the most urgent scans. We can see that reduction again. We can see it then gradually picking up now as we come out of lockdown. So you might think, well, one of the things that we want to impress is that although the amount of general anaesthetic scans have fallen, this graph shows that the amount of pediatric patients scanned on the Ingenia, which is highlighted here on the Ingenia Ambition, I should say, has increased. So we're able to say that although we've reduced our general anaesthetic activity, we've actually increased the amount of children we're scanning on the Ambition. So now we're able to scan younger and younger children, you know, with the play preparation, with the psychological preparation that Alex was talking about, but also the features within the Ingenia, we believe, have led to us being able to scan many of these children without anaesthetic. I will now hand you back to Alex, who will talk another feature on the scanner.
Yeah, so on this slide, you can see the back of our scan room, which is showing the position of Vital Eye, which also plays a huge role in our department. Vital Eye works on an infrared light, allowing it to accommodate a different breathing behavior of our patient, whether they are using their belly, thorax, they moving their shoulders, which is also important from radiographer point of view. We no longer have to remember to place the bellows on the patient, sometimes having to move it as it is unable to pick the respiratory rate well enough. Vital Eye also monitors the patient breathing and will ask the patient to breathe in at a point that is comfortable for the patient. This can save time as the quality of the images has improved, requiring less repeats and less radiographer time setting up the patient. It automatically switches on when a breath hold sequences is selected. We find that although sequence can take slightly longer to acquire with Vital Eye, there is an improvement of quality of the image, in our opinion, worthwhile investment. In this slide, I want to show you an example of the breathing praise. If we find that patient is struggling to hold their breath, we can easily switch to a free breathing sequence, and then Vital Eye just takes over. Vital Eye can be used with the majority of different sequences types. However, it cannot be used with dynamic post-contrast sequences, as these are time critical, as we all know, and Vital Eye is patient-driven. And now back to Ravi again to discuss some cases and the quality of images from radiologist's point of view.
So we can see here, this is a scan of the upper abdomen, the liver, the spleen and the stomach are all detailed here for you. The scan on the top is a scan performed during a breath hold, and the patient was having difficulty cooperating with the breath hold sequences. So the radiographers could just take the instant decision to scan the patient free breathing, and when although vital eyes always on, this is kind of where it takes over, and it sort of accommodates the breathing behavior of the patient. And I think you can see that there is more clear detail on the bottom scan, where the patient's just free breathing. You've got more delineation of the structures within the liver. We can see the spleen and the stomach are all a bit more, sharper, and this scan is done on free breathing. So it just allows you to be a bit more flexible with your imaging strategy. If you feel that the patient's not is uncooperative or not holding their breath, then you can just kind of switch your strategy instantaneously while you're scanning. It allows you a bit more flexibility. So this is so I'll just go back there. This is a scan of a 90-year-old lady. Again, the history is outlined for you up here, but she had a bit of deafness. She had difficulty in holding her breath. Otherwise, she understood all her instructions, but she just nevertheless had difficulty holding her breath. And we can see that during the breath hold, there's respiratory artifact there. And then we then again elected another example where we elected to remove the breath hold instructions and just allow her to free breathe. And you can see again, this is sort of where vital eye takes over and does its thing. And you know the detail around the liver is very sharp. The detail it looks essentially motion free, although it was done free breathing.
Compress sense. In this case, we won't be talking about the technical aspect of compress sense. We just want to focus how it affecting us as an end user. Just a general note for radiographers that compress sense can be used with all body parts in 2D, 3D, and dynamic sequences. And for people who are scanning on Philips, it is also important to know that compress sense cannot be used together with sense, one or the other. Compress sense is used to decrease the scan time without compromising the quality of images in our department. Just to know that higher we go with compress sense level, the reconstruction of images can take slightly longer. But we are able to increase our workflow, particularly in this time of pandemic, when the extra time is needed to prepare the patient and also to clean the room after each patient.
So, I mean, I'll just take you through some of the, you can see here we've got images of the foot that we produced. We can see a scan here, the history here is essentially midfoot pain, stress fracture, mortise, neuroma, tendinitis, or synovitis. We can see here we've got a scan without compressed sense. The scan time is 5 minutes and 10. We increase the compressed sense factor to 2. And we can see the pathology here, the navicular, the cuneiform, the edema within these two bones, probably a stress reaction or some joint degeneration. It's barely possible to detect any reduction in image quality. I mean, I'm absolutely happy to report on these. We would go with, this would probably be our the compressed sense factor of 2 would tend to be our go-to sequence. We then pushed it up to 4. Again, you may detect a little bit of noise creeping into the soft tissues, and essentially they're entirely diagnostic. You've got that tool in the bag. If you've got, a patient that you want to get through quickly, you can drop the scan times down for no reduction in diagnostic data. I'm very happy to make a diagnosis off any of these scans. You can see here, this is a 3D volume isotropic sequence of the knee. In our institution, we would tend to do a T1 weighted sagittal sequence and then scan in 3 planes on a fat suppressed water sensitive sequence, such as a PD spare or PDFS. we can perform this scan in 4 minutes using a compressed sense factor of 6. So this is what we do. We've got full reconstruct. We can reconstruct this in any sort of imaging plane that we want. I think we scanned in the sagittal plane. And then we reconstruct the other planes. It takes 4 minutes, and the equivalent for 3 2D sequence with a bit of compressed sense applied is around 9 minutes. So we can easily cut that down by half. And so it can, in cooperative patients, it keeps still. It can replace the need for separate 2D scans in each orthogonal plane, and the image, the level of image clarity and diagnostic detail is very high. These are excellent visualizations of the cruciate ligaments, the menisci, and the collaterals, for example. So we can just get away with the T1 and this sequence, and we're done in terms of a knee. And just for your information, if we did this particular sequence without compressed sense, it would take that amount of time. It was obviously a long time. We wouldn't do that because, this is absolutely fine. There's no quality decrease at all. I don't really see the need to do that sort of scan. Just a graphic showing the total number of examinations per year on our 3 systems. The Ingenia Ambition X replaced the Siemens Esprit that we had. This is an interesting chart. We have been, scanning on a Saturday, and these are the sorts of patients that we want to. They're the walking patients, the sort of fit and well patients. Patients who do not require contrast. A gadolinium contrast. We just want to get them in the outpatients, the sort of cold cases, so as to reserve our midweek scanning for the acutely unwell inpatient type cases. So we've been scanning on a weekend, and you can see data from months in November, December 19, January 20, and February 20. The 3 Tesla scanner, the Philips 3 Tesla that we have, is usually reserved for the more complex patients, even though they're outpatients, so that the rectal cancer staging, the gynecology kind of applications. So these scans naturally take longer. But a good comparison would be on the same sorts of scans we're doing. We're doing musculoskeletal and outpatient and brains, etc., on the Ingenia Ambition here and the Avanto, the Siemens Avanto Fit system that we've got. And we can see that over these 3 or 4 months, we can essentially scan more patients with the Ingenia, probably due to a variety of factors, the compressed sense being one of them. We can cut down our scan times, maybe also, the experience of the patient during the scan and the setup and the smart workflow, and the fact that you can start the scan as soon as the door is shut with your smart workflow. Maybe many features, I don't know. These are just the raw data. We can all make our own judgments as to the causes, but the patients on these 2 scanners are comparable, and we're seeing a productivity increase. So that fulfills one of our core criteria that we had when we were choosing a scanner originally. I'll now hand back to Alex, who will take you through some technical aspects of the multivein.
Yeah, so again, just general introduction to multivein. It can be run with a variety of different sequences, such as T2, FLAIR, PT-weighted, T1. Multivein sequences can be also taken in many orientation, and SNR is controlled by multivein percentage rather than NSA. Multivein sequences are giving us flexibility to scan patients such as elderly, children, and patients with learning difficulties. With using those type of sequences, interesting thing is that it affects with circular field of view. So sometimes using those type of imaging, we might need to increase our field of view to compensate. On the next scan, you can see more cases, and Ravi will tell you a little bit more about it.
So this is a case of a brain in a patient with learning difficulties and active epilepsy. This is the T2 coronal scan here. And we're particularly looking at the medial temporal lobes for any sort of detail or any scarring or sclerosis that could be producing this patient's epilepsy. Patient wasn't keeping absolutely still, and so the radiographer on the table can switch to multivane, and you can see the circular field of view that you get. But at the same time, you can see the detail, the grey-white matter differentiation in the medial temporal lobes, which is an area, as I said, we need to interrogate closely in patients with epilepsy. Sometimes it's not just patient motion, but sort of organ motion. This is a case of a lady with a mass in the cervix, and we can see bowel peristalsis, bowel contraction, or motion artifact from breathing. The pelvic organs can move up and down during breathing. We can see on the left here, we've got a standard sequence, which is fine, but we can't see the anterior wall of the vagina very clearly here, which is a plane we want to assess for local infiltration of this cervical cancer here. And when we switch to multivane and we're accommodating for bowel motion and pelvic motion during breathing, we can see that the wall of the vagina is much more clearly demarcated. We can assess this area for any disease extension into the vesico, vaginal sort of space here. So these are the sorts of, not necessarily patient motion, but, motion within their bodies which they can't control. We can avoid giving antispasmolytics to, stop the bowels from moving, like Buscopan or hyoscine butyrol bromide, I think it's called. But we can avoid giving these antispasmolytic agents, so we can get away without giving the patient an injection of, medication. And just going back a little bit earlier, that we were mentioning that we can do our patients, scan our younger and younger children, avoiding general anaesthetic. And I showed you a graph whereby the Ingenieur Ambition X was taking on more and more of our pediatric imaging workload. And you can sort of see the sort of things we can show you here. This is a patient with a low-lying cord and a cord lipoma. And these were external images performed in 2016. We can't really see much cord detail here. And the cord lipoma is situated here. We then did follow-up scans. This was the whole spine scan of this 3-year-old. We could fit the 3-year-old, the whole spine on there. And you can see, quite a lot of motion artifact, as might be expected with a 3-year-old. We then switched to multivane, and we can see the delineation of the cord as well as the cord lipoma is very nice. Still getting some pulsation artifact with the CSF, but we can accommodate for that. I will now hand you back to Alex, who will talk to you about ScanWise implant, which is a sort of software add-on that the Philips scanner has, which automatically adjusts imaging parameters on patients who have implants, MR conditional implants. Alex.
So ScanWise implant is an innovative addition to the software we have at the moment. Previously, when scanning patients with implants that had conditions, radiographer had to manually adjust every single sequence to meet the conditions of the implant. With the ScanWise implant, the conditions are entered at the time of the patient registration, and the scanner will automatically adjust every sequence to meet these criteria very often without increasing the scan time. This decreases radiographer anxiety, as they only need to check that they have input the correct conditions and not check every sequence to meet those conditions. We have found now, especially these days when we are bringing more patients to deal with backlog into our department, that we are building our confidence and reassurance that our patients are safe, as majority of them are patients with pacemakers. And the number of those patients are increasing every year. And now let me take you through this platform step by step. What does it look like? So here's the first windows, which shows you when you are registering your patient. And you have two options if the patient is pregnant or has some implants. If you say yes, that the patient is pregnant, it will automatically put SAR, which cannot be higher than first level. If we say that the patient has some implants, we have three options. We normally use two because with the third option, we think patient shouldn't be on the table. And then in here, we can say if it's allowing for 1.5 Tesla or not. Then we can put more details on, and this is very helpful with mentioned patients with pacemakers. And then another step, every single step with the red star needs to be done. And then at the end, we just need to confirm that we've entered all details correctly, we checked everything, and we are happy to scan the patient. And another platform with field maps, and Ravi will show you some examples of our free helium operations.
So yeah, one thing we've not talked about throughout all of this, apart from now, is the helium-free operations. And I mean, there's a reason for that, but we'll go through some of the advantages and benefits of not having to worry about the helium. Right from the beginning, the building costs were reduced. We didn't have to put we had a quench pipe in there. It was in need of a complete rebuild, but we don't need a quench pipe with this system. You don't need to refill the helium, so you don't have to worry about using a scarce resource. You just don't need to worry about it. You don't need to train your staff in cryogens. As I mentioned before, there's no quench pipe. You can situate the magnet. It's lighter, so you can situate it in different areas of the hospital. You may not need to take as much reinforcement of the floor when you're planning your build, et cetera, et cetera. But from my perspective, I mean, so I sort of don't worry about any of that. I'm the radiologist, and I just want to know, does helium impact on my image? Does helium impact on the patient experience? Does it? Those are the things that matter to me. I'll let the builders worry about that, and the people, the other people worry about these other things. But no, I mean, there's no compromise on image quality. Patients go through the scanner very quickly. It's not slower. The operator, there's no difference with operating a scan with this very, very small level of helium than a standard MRI scanner. So the helium issue has just sort of gone away. We don't really worry about it anymore. You can just sort of forget about it. It's just, and we have forgotten about it essentially. So yeah, just forget about helium. It's not really an issue anymore for us. We've even forgotten that this is a helium-free scanner. Anyway, yes, that brings us to the end of our talk, and would like to take any questions that you may have. Thank you very much.
Thank you.
Thank you very much, Dr. Ayer and Aleksandra Kudyk. I'll ask you to turn your camera on now, and we will go through a bit of a Q&A. We have some questions coming in. Okay. Let me pull up the first one here. Great. So a question to you both, whoever wants to take it. Do you see any benefits to scanning oncology patients, particularly ones that are in pain on this particular system?
I'll start by answering that one. Yeah, I mean, there's several of the features that we mentioned. For example, the oncology patients are in pain. That often translates to the fact that they can be agitated, can have problems keeping still, can have problems maintaining a breath hold. So several of the features that we discussed in the talk, namely the ability to be flexible in one's imaging strategy and switch to vital eye if you perceive that the patient is not being able to hold their breath, to get yourself a nice motion-free image. That's one good thing. Keeping the scans short, using compressed sense. We kind of sometimes see compressed sense as something for nothing, a benefit. You get a benefit for not much sacrifice. You can reduce the scan time quite considerably with no detectable to the human eye reduction in image quality. And then if you've got multivein as well, where that's a dedicated motion artifact reducing sequence. So you have essentially many tools at your disposal to help these oncology patients, particularly patients in pain. So we would potentially prioritize the ambition for those difficult, challenging patients.
And we as radiographers need to make sure that those patients are as much as comfortable as we can to make it, because we have those great thick mattresses which are also making a huge difference. Vital eye, so there's not much equipment going on the patient, which is also good because they are in pain, we're not pressing on them. So, and all those features Ravi mentioned are giving us that opportunity to play and to make sure that we can deliver those diagnostic images for radiologists.
Great. Maybe along the same lines, so we have a question. You mentioned your NBOR helps to reduce GA and claustrophobia, but of course, does that actually help with the compliance?
Compliance, yeah. I mean, essentially, I think we've been able to employ a variety of strategies to decrease our general anesthetic rate and increase the amount of children, particularly children, who are the primary users of the general anesthetic service through the scanner. Now, a lot of those, quite a few of those are probably scanner related. So the scanner environment, the movie, the kids just like watching a movie. The wide bore and the ambient lighting, I think all those things help. I think at Poole Hospital we have also won awards in our play therapy practitioners who really can distract the child as well, and have also reduced our anaesthetic rate. We also prepared the child prior to the appointment, so we really take it seriously for children. Generally, also we've noticed there are lots of patients who are absolutely claustrophobic. We generally try to not discourage those patients having a scan. That would be too strong. But we really are precious on allowing our scanner slots for people who require a sedation, conscious sedation in MRI. But there are people who, for medical need, just need to have a scan. Those patients who are having tumor follow-up, brain tumor follow-up, for example. And we have a few patients who have never had a scan without anaesthetic, who now we have managed to turn into having scans without anaesthetic. So now it's kind of transformed their experience of MRIs, and they now know, now they've done it once, they know they can have a scan subsequently without anaesthetic. So that saves, that's a massive benefit, because our anaesthetic slots are so much at a premium and are really reserved for children. And even then, we're trying to get that down.
That's great. I love what you said about the play therapy. I mean, it really shows that you guys are planning pre-scan, through the scan. I mean, it's not just what the scanner does alone, but you really have a plan for these kids to get them through it. That's really interesting.
And the whole team is involved. So we're also planning those visits before. They only take normally around 10 minutes. I personally can say that on the beginning, when we were introducing that, I was quite skeptic about it, but actually it's really working and it's making a huge difference. And with claustrophobic patients, I can give you examples from our everyday life. People last time I scanned a patient who always had a scan with an eye mask, and she was consisting that I really need an eye mask. I really need an eye mask. And I said, just give me a chance. Let me show you. What does it look like? And after the scan, she was so grateful. So now we also having a patients who wants to have a scan in this hospital on this scanner, and they are not from our region. So
yeah, that gives us another issue. But yeah, you know, that's all good. It's a big successful story in general. Yeah.
I mean, it sounds like it's even impacting your bedside manner, because you're confident that if they go in that way, they're going to be able to come out at the scanner fine.
I think that'd be fair to say. Yeah.
Cool. Another question. So this is maybe not necessarily related to what you were talking about in your facility, but I think people are just curious. How are things going currently at your facility with regards to the current pandemic situation, both on staff and on patients?
Who wants to take that one on?
So there are days when it's really difficult and challenging, because in England we have that track and trace system. So people are trying to not go, to not mix with other people. We're all using that app. But yeah, we have a staff who have COVID or who've been contacted by track and trace system to self-isolate. So there are challenging days when we really short staff, but we are relying on people's goodwill to take overtime. So we're really lucky. We have a great staff, great team.
I mean, we locked down in March. We stopped all routine NHS activity. So we built up a backlog. So we had many cases. And I think it's testament to the hard work of our staff doing overtime. With adequate social distancing, keeping gaps. We reduced the throughput actually by design. The scanner can go faster, but we had to reduce throughput to allow decontamination. We've now got those processes, a bit more slick. We're a bit more accustomed to what we've got to do. So yeah, we've managed to get our backlogs down. So we've scanned all the patients we've needed to scan. And I think, now we're coming into the second wave. We've learned from the first wave. We are more prepared. I think there'll be a higher threshold to lock down against locking down as we did in March. That is my personal prediction. Let's see how things go, though. And, let's see what happens with the vaccine, obviously.
Well, thanks for sharing your experience. Sorry, go ahead.
No, that's fine. I just wanted to say that we also have massive support from hospitals around us, which are taking our patients and helping us to scan them. So it's a good collaboration with other colleagues.
That's great to hear. Well, wishing you all the best, especially in this next wave. Let's see. I see another question going back to the helium-free operations. Do you feel that a sealed system like Ambition gives you any downsides in image quality?
No. Basically. It's I'm trying desperately not to repeat the Philips marketing line, but it's very difficult not to.
Be honest.
Yeah,
be honest.
You can. It's essentially you can forget about helium. Essentially, it's a non-issue. So you can treat the scanner. You can work it as hard as a helium-filled scanner. You can run patients as fast. You can scan as many patients as you want. It's difficult to we're not conscious of it, so it's difficult to comment on something that is not there anymore, if you know what I mean. It's a non-issue.
Well, I think you kind of answered this next question, but just to make sure we get it out there, do you require any downtime to allow the system to cool, since you only have 7 liters of helium?
Also, no. We are using the scanner as normal as other 2 scanners we have in place, and no problem at all.
Yeah, it's as I say, it's the same experience as using a helium filled scanner. So yeah, it doesn't, it's just the same experience. There are no differences.
Great. Well, hey, thank you guys so much for your time, and I really appreciate you taking some questions. I hope you guys are doing well, and I hope we get to see you face to face sometime soon. And also thank you to the audience. I would ask you to hang out for just another minute as we go through a few survey questions, just so we can learn what we need to improve for future webinars. So the first question we would ask, if you're still on the line, is on a scale of 1 to 10, how would you rate this webinar? 1 being terrible, 10 being excellent. So we'll give a few seconds here to give your... And again, these surveys, they're all anonymous. We won't actually see who wrote the answer, but we just appreciate this feedback. And next, how likely are you to recommend this webinar to a colleague? Are you very likely or very unlikely? And just an open field question here. What can we improve in your opinion? And then lastly, what kind of topics would you like us to explore at a future webinar? And we really appreciate these answers. I hope you guys are all doing well and safe. We thank you so much for tuning in. And we'll see you next time. Bye-bye.